Meet my three beautiful friends here. One is Fatrof. Fatrof has osteoarthritis. Staff E, very pretty, she has static arthritis. And Fafiz, she has rheumatoid arthritis. So let's dive into these three bone joint diseases. Fatrof, as you can see, the O here standing for osteoarthritis. Fatrof is a mnemonic for risk factors of developing osteoarthritis. Okay, the F stands for female, she. A stands for age, it's more common in older ages. T stands for trauma. R stands for repetitive use and carrying heavy load. O stands for obesity, as you can see here. Okay, and the last F stands for family history. So there's genetics and environmental. Yeah. So this is the most common bone joint diseases. Okay, articular disease. It is a degenerative disorder of the articular cartilage. So do you know what happens? Let me show you. Assuming these are our bones and this is our articular cartilage, like that. What happens? The chondrocytes will produce these enzymes which will digest the articular cartilage. And once that has been destroyed and we have the two bones rubbing into each other, these will produce changes that will now be called osteoarthritis. Okay. And what happens here is that there's degeneration first of the articular cartilage, and then later there's inflammation. Okay. We are going to see why it's different from rheumatoid arthritis, whereby the hallmark in the beginning is inflammation. Okay. But here the hallmark first is destruction of the articular cartilage. Okay. Okay. So what are the most common joints involved in osteoarthritis? We have the distal interphalangeal joint, okay, proximal interphalangeal joints, and first carpometacarpal joint, okay. Also the knee, hip, and spine is affected, okay. Clinical features, of course, it's gonna be very painful. Our Fatrophia, the pain is so bad that she cannot do any work because this kind of pain is increased by activity and relieved by rest, okay. And also another important thing we're gonna see is deformities. We're gonna have something called Aberdeen nodes, okay. Aberdeen, the D standing for distal interphalangeal joints. So there'll be swelling around the distal interphalangeal joints called Aberdeen nodes, and swelling at the proximal interphalangeal joints called Bouchard's nodes. So radiological features that we're going to see, I use the mnemonic SESOC. S for space, they'll be reduced to joint space. E for evaluation, there'll be evaluation of bone, okay? And S for sclerosis, subchondral sclerosis. O for osteophytes. C for subchondral cysts, and it's asymmetrical, of course. So treatments that we're going to do for osteoarthritis will be weight loss, of course, and exercise, as well as NSAIDs if all those don't work. And at the end of the day, we might need surgery, okay? Then rheumatoid arthritis, let's meet our friend here called Fafiz. Fafiz is a risk factor for rheumatoid arthritis. F standing for female, age standing for older age, 40 to 60, and family history, of course, is the genetic component of it. And yeah, environmental factors also included. And then I for infection, and S for smoking, okay? It's an autoimmune disease that involves this formation of antibodies against CCPs, that is cyclic related proteins, and IgG, which will form complements that will be deposited in the synovium, okay? And this will cause synovitis. And then so there'll be inflammation of the joint, which later is going to damage the cartilage and damage the joint. It is symmetrical, okay? So joints involved in rheumatoid arthritis, we have proximal interphalangeal joint, okay? Middle interphalangeal joint, the wrists, okay, and the foot, we shall have metatarsalphalangeal joint being involved. The knee, hip, and elbow also can be involved, as well as the shoulder and the spine, okay. The pain that we see here is the inflammatory kind of pain in osteoarthritis, which is worse when you rest, okay, and it improves with activity, okay. And then other thing, it will be deformities. We're going to see deformities on the hand, the swan neck deformity, the bottom neck deformity, and the Z deformity. On the knee, we're going to see flexion of the knee, okay, posterior subluxation of the tibia, and external rotation of the tibia. And then on the ankle, we're going to see equinus ankle, okay, and on the foot we're going to see amateur as well as hallux valgus, okay. So this American Rheumatoid Association diagnostic criteria for rheumatoid arthritis, where you, if you have 4 of the following, you have most likely rheumatoid arthritis, okay. And I use the mnemonic 3SSSHRX. 3 standing for at least 3 joints being involved, okay. Triple S standing for stiffness in the morning more than 1 hour. Another S standing for symmetrical joint involvement. Serum rheumatoid factor being elevated. That's the third S. H standing for hand joint, at least 1 hand joint being involved, and rheumatoid nodules, and X-ray if you see wrist or hand erosion, okay, and periarticular osteopenia. So radiological features we have mentioned, there will be periarticular osteopenia, periarticular erosion, and reduced joint space, okay. So how are we going to help Fafiz? So Fafiz, you will have to change your lifestyle, eat healthy diets, exercise, okay. Physiotherapy will also help, and if that doesn't help, you might have to use medical therapy, that is demands biological agents or corticosteroids, okay. And surgery at the end of the day if the joints become too damaged, okay. Let's meet Staph E. Staph E has septic arthritis, which is most commonly caused by Staphylococcus aureus infection, okay? There'll be severe swelling around the affected joint and systemic signs of infection, of course. And the joints affected will be rested at the position of ease. For the knee, we're going to see flexion. And for the hip, we're going to see FABA, that is flexion, okay? Abduction and external rotation. And then we have this thing called Cocker's criteria. This is used to diagnose septic arthritis. And if 3 of the following, that is white blood cells more than 12,000 cells per millimeter cubed, and ESR of more than 40, inability to bear weight, and fever that 8 degrees Celsius or more, if you see 3 of those, there is more than 90% chance that you're dealing with septic arthritis. And what are we going to do? Empiric antibiotic treatment for as we wait for culture and sensitivity. We're going to continue with antibiotics for 6 weeks, 2 weeks IV and 4 weeks oral, okay? And then, of course, surgery. Most of the patients will need it at the end of the day for irrigation, debridement, and drainage. Good. So that is it.